Hello, friends. I'm Dr. Vivek Verma, Orthopedic Oncologist at Max Hospitals. So I'm looking forward to see you all at this Ortho Onco course. Now, this is a 2-day course, and we have, with renowned faculties, we have framed this 2-day program so that anybody who has either read a lot about Ortho Onco or who is totally novice to the concepts of Ortho Onco, it will benefit both, because the theme basically is to take you from the basics to advances. Now, how am I going to do that? So, in this session, we have 3 faculties. I'll be the one who will be navigating the entire course. And with me, Dr. Vivek Ajit Singh. He is a very senior faculty from Malaysia, ortho oncologist, practicing there for so many years. Then we have Dr. Abhijit Salunke. He is at Gujarat Cancer Research Institute and very well-known figure in the field of orthopedic oncology. So what we are going to cover is, we have divided the course in 2 days, and there are 4 different parts. The first part, the part A, is about generals of oncology, orthopedic oncology, where we have a dedicated session on the radiology, where we will be discussing about how to read X-rays, how to differentiate different tumors. Once you know how to read X-ray, then the question is how to approach further if you see any abnormal X-ray. So a session where we learn about approaching the pathological bone lesions will be there. One part which is always weaker for orthopedic resident is about the pathology. So I know you all are very good in taking knife and cutting body and seeing blood, but ortho-onco and even in exam, it requires some more discussion about your pathological aspect. So we are covering that as well, the pathology which is relevant to orthopedic oncology, not just theoretical, but what an orthopedician must know. Biopsy tips, techniques, and video demonstration. All these are part of our general oncology. The second part, the module B, is about dealing with benign bone tumors. So benign bone tumors, there are so many. We are going to cover maximum the basic principles about dealing with benign bone tumors and individual histologies also. Your osteoblastoma, chondroblastoma, simple bone cyst, aneurysmal bone cyst, and specifically about giant cell tumors. And we have framed it in a way that it benefits you in developing your concepts as well as to prepare you for the exams. We are going to discuss the techniques of extended curettage with surgical video demonstration, when to do curettage, when to resect. All these things will be there. And importantly, we will be discussing about the role of systemic therapy and newer advances in giant cell tumors. Your bisphosphonates, denosumab, it will be all made clear to you. Now, in module C, we are going to deal with malignant bone tumors, where we have different sessions. Primarily, it is about the overview of how we manage a malignant bone tumor, especially related to limb-saving surgeries, what it is actually, indications, principles, different types of resection. We have also clinical scenarios where we can discuss about how do we manage, and the faculty is going to present it to you in an algorithmic pattern. It's not just going to be a descriptive ones, but something in an algorithmic pattern so that you learn how to write in exams as well. Especially about osteosarcomas, we'll cover all types, osteo, Ewing's, and chondro, but osteo in detail, so that you know about basics of chemotherapy, the classifications, treatment outline, so that you can write in the exams. Now, part 4 is actually miscellaneous. Miscellaneous because these are covered in many places, like the bone sterilization technique. What are the different ways to sterilize the bone? Normally, we know probably ECRT, cryotherapy. So here we are going to learn about pasteurization, autoclaving, extracorporeal radiotherapy. pedicle cryotherapy, liquid nitrogen, everything. Now, special lectures are on extracorporeal radiotherapy, what it is, the indications, the techniques. Another lecture is on tumor prosthesis, where we want to know the evolution, to understand the concepts, what are we using now, what is constrained, what is non-constrained, what is customized, what is modular type of prosthesis, and the recent evolution, what's happening. Alloprosthesis composite, something which is very rarely done in India. We're going to have a lecture on that so that you can see it, how it is really done practically. Now, one talk is also on the recent advances in orthopedic oncology, where we are going to summarize right from your diagnostic tools, which are new in the identification of the disease, to your biological advancements, the genetic molecular studies which are coming up, to the surgical techniques with 3D printed implants, navigation, their role, and many more things, which are the recent advances. So I think if you attend this 2-day intensive course, which is going to be fun with the type of faculty we have, we'll have a good time together. So do join us and benefit from this course. And it is going to be an interactive session, right? As it is there in most of our lectures. It's not a one-way lecture. We have framed so that you can ask your questions, you can ask your doubt. We will have ample timing. Though we start at 3 o'clock in the evening, but there is no end to it. Till you have questions, we'll be there to help you out. So best wishes, and I hope to see you all, and best luck. Thank you.